what happens is there were very many elderly people who were very busy, who were really working very hard. They may be doctors, industrialists, entrepreneurs, scientists, 70 plus, 75 plus, and suddenly because of the pandemic, since last 1 year, more or less, they are confined to the house. They have not been able to go out because their children are telling them not to go. Their inner calling is also there not to go, and they are a little apprehensive. And sitting at home has taken a toll, to a large extent on their mental health, mental emotions. So how can we, Sister Shivani, especially for the elderly population, uh, help them to, kind of deal with this suddenly sitting at home, and, when they were in the hospital or in the office or in the industry or in the lab, they
Very
had
active.
no time to eat food, but now they're at home and that's taking a toll.
Yeah.
So any words of advice, Sister Shivani, for this subset of people?
Yeah. Simple is first have a very clear cut lifestyle routine. What happened when we were going to work every day? We had a fixed routine. We need to continue having a fixed routine even when we are at home. When a person stops having a routine, that's when the mind and the body starts going, okay, now why do I need to wake up early? I don't have to go anywhere. Why do I need to get ready early? What is the need for me to get ready early? I don't have to go anywhere. So this whole thing that I have nothing to look forward to during the day, I don't have to go anywhere, tells me that I don't need to have a routine. But that's not right. For the mind and the body, Sanyam and Niyam, which means a lifestyle of discipline. So wake up at the same time that you used to wake up, sleep early at the same time that you used to wake up. Now, when you wake up in the morning, you have a little extra time. So you work on that little meditation, that spiritual study, and your physical health also, in case you were not doing that before. So give yourself a good 1 hour during the morning for yourself. Second, even by being at home, because of all the technology that we have now and because of the ways that we are getting connected with each other, continue to be a part of your work. Don't think that just because you're not going now, you're not a part of your work. Because if you start feeling that you're not a part of your work, within another 6 months or 1 year, you will start feeling you're not wanted. You're not needed. Because what happens, a system gets used to working without you. Nothing stops for us. Today we go there, we are completely involved in the system. If we don't go for 1 year, the system will adapt without us. And then if we suddenly go, we might not be, and everything is got happening on its own. So continue to be a part of that system online.
Right.
Be a part of meetings, sit there in every meeting, have your suggestions exactly how you would do in the conference room. Get used to that digital platforms. You will be able to do most of your work online, and it's very, very important for us to do that. Then you have your fixed eating habits. Do everything you were doing when you were going there. It may be little lesser than that, but it's not completely over. That's for sure. We should continue doing everything digitally. You can also have a daily routine of certain hobbies which you were not able to do earlier. You
Right.
were not. Now engage in them. Keep your 1 hour for this, keep your little 1 hour for this, but have a schedule. Any person who stops having a schedule, it's only then when things start getting affected. If I have a schedule and if I'm in, and a very important thing that you can start doing is seva. Seva. Seva is very important, and seva can happen even from home, because right now we are not going to go outside anywhere. Get involved with NGOs, contribute your wisdom and experience of all the years only you have and nobody else in society has that. So give it to NGOs, give it to organizations, give it as a consultant, just as seva. You don't want anything in return. It's purely seva. Seva is going to give you a completely different energy here. Different energy. Talk to everybody who's not well. Make it a call to call up, make it a point to call up everyone who's in quarantine and talk to them at least for 5 minutes with a lot of positive energy. You will get energized after that. It's only a question of a few months, but these few months spent the right way will only bring us out stronger out of this.
Let me go to the next question, the fourth question which I have, and that is something which most of the doctors are going through. What happens is now we at Sancheti Hospital have a COVID ward. Many people are in their own hospital admitting COVID patients because there's overwhelming number of patients. Some are directly involved, some are indirectly involved. And every day, Sister Shivani, all of us, all doctors get calls that we want a bed, we want a ventilator, we want an oxygen bed. And the feeling which I echo of helplessness, help, despair is a common feeling which most of us have experienced in the last 3 weeks, which probably in the last 30 years we have never faced. In these last 3 weeks, collectively, to say no, a patient is in an ambulance, his oxygen cylinder is getting over, and he calls you, Dr. Parag, what do I do? Where do I go? I know that there is oxygen supply. Our hospital is on the last cylinder. Ventilators, all of them are booked. And, so it's very difficult. And this is something which every day in our meetings, when I talk to my friends or doctor colleagues, this is a common thing which is going on, a feeling of despair, feeling of helplessness, which eats us. That's a negative affirmation in your language.
Yes,
So
yes.
I really don't know how to handle this and how to come about this feeling of despair and helplessness. Can you help us, sister?
This is something which a lot of us are going through. Of course, doctors and hospital people get the maximum calls, but a lot of other people also get calls. Can you help me? Can you connect me to this one? Can you get me? Now, okay, the situation is not easy. Again, the pressure is very high, the numerator, right? It's not at all easy to say no to somebody when you know what the outcome of that no will be. Because as a doctor, you can already see the outcome that if this person does not get a bed within 6 hours or within 24 hours, you are already able to visualize the outcome of your no. So when you say a no and when you see the outcome of your no, it becomes a huge moral responsibility. It becomes a huge karma. And somewhere we start holding ourselves responsible when something might not go right, when that person probably might not that day get a bed in any hospital, and then we know what can happen. And somewhere that will get recorded on our mind saying, I, directly or indirectly, have been a part of what has happened today. Now, just let's pause. If we look at it like this, yes, we will feel we were a part of it. Now we have to look at it spiritually. Now, this is where spiritual principles are very important. First thought, I am going beyond my capacity to help. Is my conscience clear? Yes, my conscience is clear. I have to keep my conscience clear, which means my karma has to be accurate. Am I being careless? Not at all. Am I being laid back? Not at all. Am I stretching my boundaries completely? Totally. Totally. Is my conscience clean? Highest level of cleanliness that this time. That we are doing everything our best. Was my karma right? Absolutely, it was right. Could have I accommodated them? Didn't have place at all. Did I make a mistake deliberately? Not at all. Talk to your mind. You are going to question your karma. Nobody else is going to question you. So be very, very authentic inside that I stretched my limits and I did everything. Second, after that. Now, please take this in the right perspective. Please understand we can help people, we can treat people, but we don't write the destiny of people.
Right,
Don't
right.
take that burden on your shoulder.
Yeah.
Not even during COVID, and actually not even without COVID also. Like when you do a surgery, sometimes everything is perfect and you were perfect, and yet the result was not perfect. It does happen sometimes. And sometimes everything was complicated, but the result is so beautiful. There is something more than just you as a doctor, and you have witnessed that regularly. And that what is more is the destiny of that person, and the destiny of that person is that person's destiny and their karma. If somebody has to get a bed now, anything will start happening and they will get a bed from out of nowhere, even if there was nothing, and it will become available for them. And everybody will say, from where did this person get a bed? It was not possible. That person's karma and destiny is making it happen, even if everyone thinks no. And sometimes simple things get complicated. So please don't think that we can write destiny of people. We are only small puppets in this whole drama of the world, we're just little parts. Even God does not write the destiny of people.
Right.
We write our destiny with our karma. We only need to be clear that my conscience, my karma is right. And every day, every night before going to sleep, please do this. Surrender what has happened during the day to God. Please don't go to sleep with it. Over a period of time, that trauma will start getting recorded here. So before you go to sleep, just surrender. Today I did this, I did this, I did this. I was not able to help this person. I tried my best. Cleanse your system before you go to sleep. Cleanse your system and surrender and say thank you for everything that went perfect. Please don't focus only on things which are not going right during the day. It's very important to focus on the things which are going beautiful during the day and say thank you and thank you and thank you. The more you will say thank you and shukriya for everything that's happening perfect, the more perfection will start happening. It's an energy. But the more we focus on this is not happening right, this is not happening right, then more things will not happen right. This is a law. This is how energy works. So focus on everything that's beautiful. Surrender to God before you go to sleep. And that moment when you say a no to somebody, that moment when you have to say a no to somebody, verbally you say a no, and in your mind you say, I tried my best. I tried my best. God bless this soul and let them go forward. Which means God bless this soul means we are sending them with a blessing so that they can go forward into another hospital and get what they never say no what. This recording here is very, 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 very important. Very important.
I have last two quick questions related to this particular thing, and then we'll open it up. There are many other on the Zoom call who also want to ask. You know, one thing which is irreversible about COVID is death. Apart from death, a person has a problem. He has cough, he has fever, he has lost his smell, he has lost his taste. That all comes back. He can get into good health and he's back to normal. But when a person dies, he goes. But that leaves a big scar, a big crack, which is something difficult. And had the COVID not been there, he wouldn't have died. And that's my next question, which I'll come to a little bit. But COVID has come. It was not expected how it has come. Let's not go into that. But there's something which has come, and my relative has gone. My well-wisher, my friend, my colleague has gone. I believe recently also one of your sisters, Sister Kanupriya, she passed away. I read about it. It must have been a big trauma. So that is something which leaves a scar, and it leaves a kind of a permanent scar. How can we heal this scar as soon as possible, and deal with it? I know it will remain. See, that person, you can never forget Manupriya's sister. I know that she will always be there, but it leaves a emotional trauma. Sometimes you feel again, oh God, had I done this, had I done that, had this medicine been available, had that been available, because of this COVID, there are a lot of ifs and buts to it, and which add to the trauma. In a normal situation, there's a road traffic accident, there's a myocardial infarction, somebody dies, you don't feel that bad, but the COVID connotation to the death has added to the trauma. So, Sister Shivani, please help us how to deal with this.
Again, the coming of a soul and the leaving of a soul, which means a birth and a death. Reason can be any. Reason can be any. You said accident, it doesn't affect us so much. That's because that happens once in a while, no? You see, this COVID is just coming every day. Every day something is happening. And we were not prepared and young. And we thought they're just going into the ICU, they will come back. And then this is what happens. So the mind is facing a situation which is new. What happens normally, the mind has got prepared with that situation, but now what is happening, the mind is not prepared for that. First thing, the birth of a child, the soul coming into the womb of a mother, and the soul leaving the body is the destiny of that soul. Again, karma, and destiny. These spiritual principles will have to be held on to right now. It's very, very important. Science will not be able to give us all these answers now. So, spirituality will have to be held on to. Religion has taught us the law of karma. So, it is the destiny of that soul. What is my role as a doctor, as a family member, as a friend? To be a part of that destiny of that person and help in every possible way. So we all helped in every possible way. I was a part of Kanupriya's thing happening in every possible way, with every possible way. So we've all helped, we've all tried. But if it is the time for the soul to leave, everyone coming together is also not able to stop that from happening. The reason could be COVID, the reason could be something else, but it's time for the soul to leave. Now, till the soul is in the body, we try everything, okay, everything. But the moment the soul leaves, now we have to focus here. What are the thoughts that I want to send this soul with? It's our responsibility. The soul is leaving right now in a lot of pain.
Right.
We all pray for souls, no, when they leave, and we say, pray for them to be peaceful. Where is peace right now? There's no peace at all. So, how are these souls going to leave with not even having family around them, with not even having the normal funeral that a soul gets before the body gets? So, it's a lot of things, even for the journey of the soul. So, it's very, very important to create very nice thoughts for that soul when that soul is leaving or has left. So, connect to God, radiate powers and blessings to them. The vacuum will never go. That vacuum is there, but not a scar. Two things are very different. The vacuum is there, but not a guilt. Not a guilt. Please do not ever create a thought for anybody. I wish I could have done more for you. This thought will reach them. I was not there with you. I couldn't come into this ICU. This thought will reach them. The soul will enter the womb of the mother. A baby is getting created. A new child and a new destiny is getting created. And this programming will get recorded there. Nobody loved me. Nobody cared for me. Nobody helped me. My family was not with me. You will see 3-year-old, 4-year-old children suddenly feeling nobody loves me over here because their family sent all that message. So we pray, we meditate, and we say, we were with you in our mind totally, even though we couldn't come into the hospital to you. We did our best, and now we radiate only love and blessings to you for a beautiful, healthy body and for a beautiful destiny.
Thank you. Thank you.
It's very important to send that. It's going to change destiny of that child there. This is something which nobody else is going to look at, because for us the death means now end, now there's nothing to think further. But actually it's the beginning a new journey.
I
The
think
new journey has to begin with the right energy.
so. One last question before Professor Ajit Shinde will ask you the next question. It's a question which is a little offbeat, but again we can talk a whole day. But a short answer from you. Uh, Basically, we've all talked about Kali Yuga, the age of darkness. The world is going to come to an end. So, is this God's way to kind of take a step forward, if at all, towards this Kali Yuga thing? And is COVID having any relationship with that? I don't know. This is something which I think your karma theory also can be brought into it. I know this is a big question, and we
No,
can.
it's very simple. It's very
Yes,
simple.
yes, yes.
Uh, let's look at the time now. It's around 6:37. It's getting dark, right? After some time, it'll be 10 o'clock. Then it'll be 12 o'clock. It's time. It's cyclic. But after that, it will be dawn. And then it will be morning. And then it will be. So it's a cycle. Morning, afternoon, evening, night. Cyclic every 24 hours. Spring, summer, autumn, winter. Cyclic every 365 days.
Right.
Similarly, there's a bigger cycle, and that cycle is Satyug, Treta Yug, Dwapar Yug, Kalyug, which means 4 phases, 4 vibrations in the world is a bigger cycle. Now, when we say Kalyug, which means the night of that cycle, Kalyug, no Kala, it's dark, and Kalyug means Kalha Kalesh, lot of pain. Now, Kalyug is becoming even more Kalyug, which means it's getting pitch dark now. And pitch dark means the vices here. That's why the emotional health is very important. Where our purity diminishes, lust, ego, greed, jealousy, this become our predominant nature. That's when Kali Yuga has reached its peak. When we start fighting with each other in the name of religion, Kalyug has reached its peak. When people are not safe at home, even with family, there is abuse within a family, Kalyug has reached its peak. So there are a lot of things that Kalyug has reached its peak. Then,
Is
of course,
that happening, sister, you think?
this is Kalyug is of course reaching its peak. There
Oh,
is no doubt about it. COVID is just a one part of it. COVID is not a sign of Kalyug reaching a peak. Our state of mind, it is the sole power which is reached completely, our value system, our principles. But that does not mean the world is coming to an end. The world doesn't come to an end. This Kalyug way of living has to come to an end. This
right,
Kalyug thought process has to come to an end. This Kalyug sanskar has to come to an end.
right.
And the Satyug sanskar has to start. So the
Fantastic.
night will end and the morning will begin. But we have to create that morning. God doesn't create the morning. God gives us the knowledge to create that morning. We have to create the morning. So sanskar se sansar. Sanskar se sansar. When we change our sanskars, the sansar will change. So
Yes,
we are going to create Satyogi sanskar and we will create a Satyogi sansar. So world doesn't end, world changes. So
right.
there's going to be a paradigm shift in the world and we all are going to be a part of that world change.
So I have one last question for you, Shivani sister, and then we close the event with a vote of thanks from Dr. Prakash. Ma'am, you have enlightened us. You have told us everything. But now I have one question. Sometimes when doctors fall ill and we don't go to our OPD, the patients tell us, "You're a doctor. How can you fall ill?
Oh,
You
how
have no
sweet.
right to fall ill." So, ma'am, if you tomorrow have some stress, some emotions,
Yes.
what is your way to deal with this? As doctors, we are not supposed to fall ill. So, as a healer, as a spiritual guru, you cannot have stress, ma'am. But in
Yeah.
case you have, what do you do?
Yeah. It's not that you cannot have stress. In a day to day interaction, the only thing is that when it's like suppose you're a doctor, no, when you will get the first symptom of something and you're aware, you will be able to heal yourself faster. If you're aware of your body, you will get the first symptom and you will know why it is happening and what it is happening. But me as a layperson will not understand that first symptom in my body. I will not know what I have to do. So you're knowledgeable as far as the body is concerned and you can treat yourself faster. Now similarly, with a little practice and seeing the mind every day and meditating, I'm able to see my thoughts, which means I'm aware of my thinking. So if something happens and I create a thought which I know is not the right thought, even a simple thing like you said, I should have been able to do this. If I would have done this little more, this could have been the outcome, even during COVID. Now, this is a thought. Now, the only thing is when I create this thought, I'm able to see that I have created the thought that minute itself when I create that thought. And then I will pause and I will consciously change that thought then and there, then and there. So that thought is getting still created, but it will get created and it will get changed then and there. And earlier, if I'm not aware, I will create it and I will go on thinking like this, and then it builds up into stress. But if you change it then and there, it's not getting accumulated as stress. It's a thought which comes, we work on it, and we change it.
Right, right. Thank you, ma'am.